Good morning. I'm Tim Colburn with Berger Health System in rural Pickaway County, Ohio. We are a 100-bed hospital. We employ about 700 people, and like many other rural areas in Ohio, the hospital is one of the largest employers in the community. The Affordable Care Act has strengthened Berger Health System. It's reduced the financial burden we have for providing care for the uninsured. Ohio's Medicaid expansion, which was allowed under the Affordable Care Act, has provided coverage for nearly 3,000 Pickaway County residents. These are working folks, including veterans in our community who have coverage. This access to coverage allows them to address their health and wellness needs. Repealing the ACA without a replacement plan will have significant impacts on the vibrancy of Berger Health System and ultimately the health and wellness of our community. Bottom line, coverage matters. Coverage is access to health care. Our uninsured population served at Berger Health System in 2014 was just over 14%, and as of today, it's about 5%. That represents real lives, real health care issues, real things that matter to individuals. What does expansion mean for those 3,000 people in Pickaway County? We've added an obstetrician, an endocrinologist, and primary care physicians. Of those three specialties added in Pickaway County since the Affordable Care Act was implemented, no less than 30% of the new patient panel for those physicians are from the expanded Medicaid product in Ohio. What does this mean for the economic health and vibrancy of Pickaway County, ultimately Berger Health System? As a 700-person employer, we drive about $50 million of annual economic impact to our community. Those are jobs, those are services delivered in our community. I'm not here to give terrible causes, terrible outcomes, but if the Affordable Care Act is repealed, if Medicaid expansion goes away, our organization will have to look sharply at what happens because of that. 70% of our business is paid for by Medicare or Medicaid services. And when you have that much uncertainty and that big a percentage of your business, we will have to evaluate services and or employment in our community, our organization. And it's easy to go back to the obstetrician, the endocrinologist, and the primary care docs we have been able to hire because of the stability Medicaid expansion has provided us for knowing people have insurance. Again, do not want to threaten these things will happen, but all good businesses, like healthcare is in Ohio, will have to look at the services and employment that have been provided through the stability of Medicaid expansion. I do echo the thoughts from our previous speaker that we should have a thoughtful replacement or enhancement of the Affordable Care Act as opposed to just a removal of the law. If you think back to Medicare and its establishment, it has been tweaked and changed many times over the years. Why not use a similar process to improve the Affordable Care Act and the good things it's done in Ohio, and specifically the things I know it's done well in Pickaway County? Thank you.